You have anything you want to say? I'm shy.
Amber Dean, seen here with her son Bobby, thought she was one of the lucky ones. The mother of 3 from Hornell, New York, had a mild case of COVID-19 in April and has since recovered. But for Bobby, it was a different story.
It started with what just seemed to us like a tummy bug. So, we were treating it as such. And then it had progressed to a low-grade fever and a heavy amount of vomiting, and he couldn't keep anything down.
The 9-year-old spent last week in the hospital, one of more than 100 children in New York struck down by a mysterious condition thought to be related to the virus. Bobby recovered, but at least 3 children in the state have died, and more than a dozen other states have reported cases similar to a rare condition known as Kawasaki disease or toxic shock syndrome. It causes inflammation in the blood vessels.
From what we know or what we think we know at this time, it's something that's occurring probably a few weeks after the initial infection. So most likely, a lot of these children were infected a few weeks ago, and now their immune system is kind of revving up and causing this inflammation throughout the body.
The leading U.S. public health body, the Centers for Disease Control and Prevention, is warning doctors to be on the lookout for the syndrome. Experts are also looking at a possible genetic predisposition, but the man leading the U.S. medical response cautions there is still a lot they don't know.
I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects.
With tens of thousands of people killed and millions more out of work, one saving grace of the coronavirus was supposed to be that children were spared the worst. Now, as there's new evidence of this syndrome coming to light, even that is being challenged. Kristen, Saloomey, Al Jazeera, New York.